In this video, I'm going to talk to you about facial rehabilitation. What exactly is facial rehabilitation, why you need one, and how exactly it is being followed. I'm Physio Meghna Dave, founder and CEO of HealthQ Rehab and a neuro rehabilitation physiotherapist. And this video is for anyone who is suffering from either facial paralysis due to Bell's palsy, Ramsay syndrome, or a stroke, or even facial tumors. This guide will ensure you to understand that what exactly it takes to work on your facial recovery. So let's get started. Friends, facial paralysis can happen due to multiple reasons, starting from peripheral, which is called as lower motor neuron type of facial paralysis, or else the upper motor neuron type of facial paralysis. In lower motor neuron type of facial paralysis, conditions like Bell's palsy, Ramsay syndrome could be the leading cause. Sometimes, if there is a tumor like acoustic neuroma, which compresses the nerve, can also give you a lower motor neuron type of facial paralysis. Even if you have gotten fall or else an injury, at that time also you might get injured facial nerve, which can paralyze your face. When it comes to upper motor neuron type of facial paralysis, this is mostly due to stroke. When a person suffers from stroke or else brain injury, at that time, the area which is responsible for the facial control, that gets damaged, due to which the face can get paralyzed. Now, in any of the situation, the focus of facial rehabilitation is on three important aspects. Number one is how do we ensure that we maintain the properties of facial muscles. Remember, your facial muscles comes with unique property which allow you and your face to function in normal way. When the face is getting paralyzed, then that ability gets affected, which needs to be worked upon. The second thing is to maintain muscle memory. Your facial muscles comes with certain memory. When that memory is affected, they tend to forget the right pattern of movements, which alters the way you use your face. And number three is to retrain your facial muscles to work the exact same way, the way they used to work before. And for this, we need to do something called as facial rehabilitation. So what is incorporated in facial rehabilitation? Let's understand. So facial rehabilitation incorporates 6 different processes or 6 steps. Step number 1 is analysis or assessment to identify the root cause of facial paralysis. It's almost impossible to treat your face in the right way if we don't know the right cause of your facial paralysis. And that's why it is highly important that you should go to a physiotherapist who specializes in facial rehabilitation and can help you out in identifying the right source or the right cause of facial paralysis. In this assessment, the physiotherapist would be able to understand whether this facial paralysis is from upper motor neuron lesion or is lower motor neuron lesion. Or as you can say, either it's peripheral facial paralysis or else it's in central facial paralysis. This identification is super important. Once that has been identified, then comes the second test, which is to identify what are the common impairments that is developed in the face due to facial paralysis. For example, if a facial paralysis due to Bell's palsy is old enough, then you might develop something called as synkinesis, which is one impairment where there is excessive tightness of the facial muscles. At the same time, there is unnecessary movements happening on the face. This needs to be identified. Once identified, then only treatment is possible. So here, your impairment diagnosis or impairment analysis is very important. This also should be done by an expert or as an experienced therapist. Once an impairment diagnosis is done, then it's time to come up with a proper rehabilitation plan. The treatment of facial paralysis has to be very strategic in nature, depending on the right goals that are being determined during the assessment. During the assessment, the therapist will come up with some short-term goals and long-term goals, and the therapy has to be directed towards these directions. For example, short-term goals could be reducing the facial muscle tension or spasm, reducing facial pain, improving the eye mobility, because that limits the ability of other facial muscles to move well. Long-term goal would be more towards neuromuscular retraining, which is training the facial muscles to move the way they used to move before. These goals varies from patient to patient, and that's why it requires a very thorough assessment or analysis. Next comes the application of protocol or else treatment protocol itself. Treatment usually focuses on solving some key impairments like improving the muscle tone of the facial muscles. Number two, to maintain a good blood supply and lymphatic drainage. Number three, to ensure that the facial muscles are positioned in right position and are taken in right position at repeated intervals so that the muscle memory remains intact. And last but not the least is to retrain the facial muscles to move in the way they used to move before. Rehabilitation techniques, methods focuses on these key goals to ensure that you get a proper recovery program for yourself. These sessions can be done virtually or else at a physical center where you can connect with your physiotherapist and your physiotherapist will make sure that you do it. One unique thing and interesting thing about facial rehabilitation is that whenever you do all the facial practices by your own hands, that will be far more effective over any other physiotherapist or any other therapist doing those massages and techniques on you. The reason being, your sensory receptors, which are present on the face, act as a guide for your facial muscles to move in the right direction. And that's what we encourage when we work with our patients. So, whenever the treatment protocol is applied, it usually is divided into phases. Number one is the rehabilitation phase, and number two is the maintenance phase. Rehabilitation phase, how long it will last, will depend on how severe is the condition. Acute facial paralysis rehabilitation can last from 1 day to 3 months, whereas a chronic facial paralysis or a synkinesis takes 1 year of time to recover or will show you some good results. Sometimes more than that as well. At the same time, when it comes to stroke, equally takes a long amount of time for you to get some visible results. That's why it's very important for you to be patient, because not every patient is same and not everybody's facial paralysis is also same. That's why stay calm, stay patient, but stay consistent. And last but not the least, the second important component of rehabilitation protocol is maintenance. Many a times I see patients feel that after taking the treatment, they have to leave. They don't need to do anything else. But please understand this, majority of neuromuscular disorder or musculoskeletal disorders require a certain level of maintenance. If not, then the facial muscles will get fibrosed, get tight, and will go back to its original position. That's why it is important that you should also practice some self-care practices on a regular basis so that you can maintain the properties of your facial muscles. So now I have an invitation for you to join a webinar which I am hosting on synkinesis self-care. Self-care webinar basically focuses on all the techniques and methods that one should incorporate in his or her day-to-day life in order to maintain the properties of facial muscles. This will definitely not be the treatment of your synkinesis, but it will be some simple practices that you can do by yourself so that your facial muscles stay relaxed. If you are interested to know more about it, the link is given in the description. You can click on it and go through all the details. My vision or my entire intention of doing this webinar is to ensure that I can educate you more and more about synkinesis, because I see there are a lot of misconceptions around synkinesis that people have, and I want to ensure that I solve them all for you. So what are you waiting for? Go ahead and click on the link and join this webinar. And if not, go and watch other videos which I have already created around synkinesis that will give you a lot of information and insights about facial rehabilitation as well. On that note, I'll end this video here and I'll see you in another video. Thank you.